If this trend continues, it could be the collapse of the healthcare system in America as we know it today.
Now that is the Ouachita County Medical Center president and CEO. That hospital, like many in Arkansas, still trying to recover from the impacts of the COVID-19 pandemic.
Yeah, for 3 years we honored hospital workers as heroes, but now inflation and the costs of paying those workers is creating financial stress. THV 11's Jalissa Garza joins us in studio tonight with a closer look at the data behind the looming crisis.
Yeah, Rolly, Faith, these challenges hospitals are facing is nothing new. They've been finding ways to make sure there's enough hands on deck and enough money to operate. But as these problems get worse, the future for many is uncertain.
It's kind of like putting a drop of water in the big ocean. It helps just a tiny bit, but it's not the cure-all, end-all of the problem.
A $6 million lifeline given to Ouachita County Medical Center in September has not been enough to help them as much as they hoped.
When you consider that half of that $34 million operating budget is salaries, labor cost. And that is exactly what the $6 million was designated to offset and be used for.
President and CEO Peggy Abbott says they've had to make difficult decisions in hopes of saving money.
Ceased operating an urgent care clinic and a primary care clinic here in our community.
Abbott says this past year they reported an operating loss of over $1 million. And according to our partners at Arkansas Business, Baptist Health of Little Rock reported a loss of $12.9 million.
That's why we were putting those cost-cutting measures in place to try to be closer to a break even, if not a slight profit.
They're not the only healthcare systems reporting losses this large. The Hospital Association says it's a trend across the state as the cost of operating a hospital continues to climb.
20% for supplies, 20% for pharmaceuticals, and then more than 30% for labor costs.
President and CEO Bo Ryle says the financial stress is hitting some hospitals harder than others. Right now, 5 are on the brink of closing.
In almost every county, there's a hospital is the largest or second largest employer. So that's a major impact on the community. It's economic development. It's economic engine for those communities.
He says they're doing what they can to try and provide some type of relief.
We've been looking for other dollars, whether that's American Rescue Act funds or Medicaid funds, but we've been unsuccessful so far.
But the future for many hospitals is uncertain.
I actually don't see any additional cuts that we can make and function as we currently do.
Other hospitals are making difficult decisions, just like Ouachita County Medical Center. According to the Hospital Association, as of right now, they don't see an end in sight to these financial hardships as expenses continue to climb and the revenue isn't coming in to match. They're unclear when things will get better.